What's going on, everybody? I am Chris Kalisz, the owner and founder of SRT, also known as Soft Stretch Release Techniques, and I want to chat today just a little bit about what SRT is and one of the main components that we actually intentionally focus on. So Soft Stretch Release Techniques works with the soft tissue in terms of a soft fascial release, in terms of soft applications when it comes to gentle stretch therapy or fascial stretch therapy. It works with the nervous system intentionally. So there's a lot of therapies out there. There's a lot of professionals, massage and PTs and chiros that talk about the nervous system without actually intentionally focused on down-regulating the nervous system and diving into a deeper layer or understanding of trying to intentionally and purposely work with the nervous system. A lot of the stuff that they do or aggressive therapy works against your nervous system. So what we try to do with SRT is first and foremost primarily work directly with your nervous system. We do this through soft, gentle, slow, safe support. All right, so those are the 4 S's of SRT. It's soft, slow, safe support. So every single time you touch, you see, you taste, you smell, you hear, your 5 senses, everything that you experience is constantly being downloaded and processed into your nervous system. And so every time somebody gets on a table, every time you touch them, you are installing sensory input into their nervous system. So, right, we have your peripheral nervous system, which are the nerves that run to the CNS or the central nervous system. And then your central nervous system is what decides and analyzes and categorizes all of the experiences that are coming in. So, if you're used to having aggressive therapy and somebody's trying to directly manipulate your skeletal system or directly manipulate and work intentionally with your muscular system, there's a neglect for your nervous system. And so if your nervous system is guarded, locked up, if there's a chronic pain cycle going on, if your muscles have trigger points and knots in them, if your skeletal system keeps getting pulled out of whack, there is a heavy component tied to the nervous system. And so what we try to do and what our main focus is, and this is why we are different than traditional stretch therapy, massage therapy, myofascial release work, is the understanding of how our touch is directly affecting the nervous system. So the softer we apply an application, the slower we move their limb or their system, we know that we are directly downloading sensory input into their nervous system. Now, does it feel safe or does it feel guarded? Does the technique or does the touch feel good or does it feel painful? So it's not necessarily about just the joint mechanics or just the mechanical function of the physical body, because we know that every single thing we touch, taste, smell, see, or hear is being downloaded into your nervous system. So your feelings, your emotions, your thoughts, all of these pieces come into play to process in your nervous system. And so if your body is guarded, if it's been through physical trauma, emotional trauma, mental trauma, psychological trauma, whatever type of trauma, it is downloaded directly into your nervous system. And so when your nervous system is amped up or jacked up and it's on guard to protect you from more pain or from putting your body into an uncomfortable situation where it might feel there's a threat, well, your nervous system is doing its job. So our job is not to force your body, force your muscles, or force your skeletal system to do what I want it to do. My job as a guide and as an SRT professional is to work directly with your nervous system If that means I do 3 or 4 techniques in a 60-minute session, that's what we do. We slowly and softly create the safety and support that your nervous system requires for it to begin the downregulation process, to come out of this fight, flight, or freeze state into this rest, digest, relax state, which now we know your nervous system is tied directly to your muscular system. And so when your nervous system doesn't feel threatened and it feels safe enough to let go, it will relax your muscular system, and then it will allow us, or me, or you as a professional, to guide the physical body into further ranges of motion without restriction or without the protection in place where your nervous system has to guard the movement. So I wanted to chat about that because this is a big component that's missing in a lot of therapeutic approaches. It's something that is super important. This is the main primary system that we focus on with SRT. And then we go into fascial system, and then we go into lymphatic system, and then that brings us as well into the belief system. But the primary intentional focus that we work with is the nervous system. And so understanding those 4 S's, soft, slow, safe, support, is going to change the entire approach of how you view your client's chronic pain. So thanks for watching, guys. Please, we're gonna put a lot more videos up on the channel. If you have any questions, always follow us on srttherapy.com. Follow us on Instagram, SRT_therapy. You can message us, soft stretch release techniques at gmail.com. All of that information is also on Instagram and the website. We look forward to chatting with you and sharing more information about what soft stretch release techniques is, what the philosophy, the understanding, and the baseline to SRT really is, because there are a lot of people who can benefit, who have benefited from SRT, and we need more people out there understanding the intentional approach that we do with SRT.